individualism, the concept of objectivity, things like that. And I think one of the reasons that I'm actually was really excited to connect with Peter and you all at the University of Hawaii is that, in my work, being a biracial, bicultural woman, and the daughter of immigrants, there are paradigms that are very strongly held, I would say, here on the mainland that are a little bit different on the islands. And so I would actually love to hear from you all, maybe when we get to Q&A or discussion and conversation about if you experience that as well. And part of my excitement about connecting with folks like you all and the students at the university is that there are different ways of thinking and knowing that are much more present on the islands than I experience here on the mainland. What are some of the paradigms that the dominant paradigms in this world might be pushing out? Things like collaboration, matriarchy, racial equity, non-binary ways of thinking, right? Does it have to be either or? Can it be both and? Different ways of running economies, collectivism, the idea that subjectivity exists, and things like that. And so I'm sure that you all could list many, many more, and actually would love if you wanted to drop in the chat either dominant paradigms that you experience in your field, in your work, in your life, or paradigms that you think are left out of the conversation a lot. So I will say that healthcare is stuck right now in some problematic dominant paradigms. And this is one of the reasons that we're coming to a place where healthcare feels broken for so many. So let's go and jump into this a little bit more interaction is a lot of folks here agreed that healthcare was broken. I'm making the argument here that it has to do with some dominant paradigms that healthcare is stuck in. I'd love to see in the chat, and then also just feel free to raise your hand and come off of mute to name some of the dominant paradigms if you agree that you might be seeing in the healthcare or the work that you do.
I could start. I think one is a focus on accuracy as the primary performance metric rather than some other, for example, fairness-based metrics.
Nice. Others. I think it's a good cue if you find if there's something in the work that you do that you find yourself repeatedly getting extremely frustrated about. Oftentimes those things, that frustration is pointing to a paradigm that's dominant, that's actually leading to more brokenness. So other folks, any paradigms that you can think of, feel free to drop it into the chat or just speak out. Transactional healthcare. Yeah, reactive rather than preventative. Nice. All right, I'll keep going. I think I shared with Peter's students when I came to give a lecture in class that I did start out as a middle school and high school teacher, so I have no problem sitting in silence as people slowly get ready to engage. But I won't do that too much because I want to save a lot of time for discussion at the end. Thank you, Peter Sadowski, so the slow scientific process. So here are some that I came up with, sort of a privileging of physical health over socio-emotional health, mental health, and even environmental factors that might be influencing health. Additionally, this idea of the expertise becoming more and more siloed, right? Like everyone is a specialist in their area. What's happening with the systems cooperation across the people who are the experts in different parts of our human body? Our human body functions as a unit, it doesn't function as silos. And so I think that's another one that came up for me. And please feel free to agree or disagree with this. I also put in the business of health over patient care. and would be curious to hear your all's thoughts. My brother is an ER physician, and I do have some physicians in my family, and I tell them that I'm a doctor too, even though it's a different kind of doctor. But they have been sharing a lot about how patient care continues to fall in terms of priority over the business of the healthcare system overall. And then in the spirit of this conversation, also just lifting up, you know, thinking of tech as a silver bullet. Oh, technology will solve this. Oh, technology will solve that. Rather than really centering the role of human beings in that empathetic connection that physicians have with their patients, and seeing tech as the collaborator rather than like, oh, well, we don't have to think anymore. Tech will solve that for us. So those are a few, and feel free to drop in the chat if you agree or disagree, or if there's spurring more ideas for you. So what can be done? I so recently, just last week, picked up this book at the recommendation of my therapist, and I'm wondering if any of you all have read any of the work from Dr. Mate, and this is actually a book that was written by him, and that's his son, actually right there. So raise your hand or drop in the chat if you are familiar with Dr. Mate and his work, so I can have a sense of how new this is to folks. Okay, it might be pretty new because I'm not seeing a lot of people. So Dr. Mate actually started out as a physician, like of Western medicine, practiced and trained in traditional medical approaches. He is now in his 70s, potentially in his 80s, and more recently has taken a turn towards understanding health more holistically, I think as he would describe it, looking at the socio-emotional, societal, and environmental systems that all impact health in a single human being. And he writes really honestly and transparently. And I think one thing that I really appreciated about his writing is that he offers a lot of humility around mistakes he feels that he made, not knowing the things he knows today in terms of the way that he delivered patient care as more of a traditional medical doctor. Yeah, he has wonderful videos. I'm going to actually show one today. So one of the quotes from this book, he talks a lot in this book, at least as far as I've gotten through, is how to look at all of the pieces that are going into a person's health, not beyond just their physical symptoms, and has been focusing a lot on cancer as well as autoimmune diseases. And he lifted up this quote that actually impacted me a lot from a woman, Megan O'Rourke. It's an article in the New Yorker where she talks about her autoimmune condition and talks about it in the sense of Hemingway's quote, I got sick the way Hemingway says you go broke gradually and then suddenly. And he unpacks this a bit in terms of how healthcare currently does sort of disease recognition and diagnoses, where oftentimes things like cancer or autoimmune diseases have been manifesting in bodies for years, but our tools are not able to track or recognize these things. And then so even though the onset of the disease has been going on for many, many, many years, all of a sudden you walk in and you might get a diagnosis for a stage 3 or a stage 4 cancer, or even a stage 1, right? It can feel very sudden to the patient because we don't have the tools or techniques yet to understand how to recognize this in the body earlier. And I'm going to play a video here from Dr. Mate so you all can get a sense of and the way he thinks. And this is a sort of a Q&A period, so you'll see a little bit of audience engagement with Dr. Mate.
Thank you so much, Dr. Mate. My name is Heather and I'm from Minnesota. I'm really interested in applying your ideas at a systems level. Healthcare in this country is in crisis. And there are many reasons for that, but in my viewpoint, something that's not talked about so often is because the healthcare system itself is trauma organized, and also because many of the human aspects of healing, the relational aspects of healing have sort of been pushed into the corners of the room. And so I'm curious, if you were to take a systems lens, how would you approach healing a trauma-organized healthcare system?
So let me tell you a few things. Somebody once said, how do you organize a cult? How do you create a cult? Well, you give them a special jargon and a uniform. You sleep deprive them. You separate them from their family, and you put them under authority and leaders. In other words, you send them to medical school. Okay, so medical school is very traumatizing for a lot of people. That's the first fact that I'll tell you. The second fact I'll tell you, there is something called, actually, Elisa Apple, who's a dear friend, and I don't know if she's here tonight, but she's speaking at the conference in the next day or two. And Elisa has done a lot of work on telomeres. And telomeres are, she'll talk about it much more articulately, but they're structures at the end of chromosomes that keep the chromosomes together. And the longer that they are, the healthier the chromosome. And as we get older, they fray, they get the chromosomes, the telomeres fray, and so do we, but stress also shortens the telomeres. They looked at the telomeres of medical residents and other people the same age. And in 1 year, the medical residents, they lost a lot more length in their telomere than other people their age. So we're talking about a highly stressed profession. Number three, some studies have indicated that the highest level of empathy and compassion that medical students have is right before their training. So you've got kind of a system, you could say it's designed that way, but it's not that it's consciously designed that way. Systems kind of design themselves. They kind of this system generates itself to generate profit and to generate power. That's the essence of it. If you want a system that generates power and profit, you're not gonna train medical students in trauma, because if you come to me with depression and I say, hey, you got a problem with lack of serotonin in your brain, and I'm gonna give you Prozac, which will elevate your serotonin level. That takes me 2 minutes. 20 milligrams a day, come back in a month. But if I had to talk to you about why you depressed your emotions in the first place, in your family of origin, I'm going to just spend time with you. Not very profitable. Even if I had the insight. So what you're asking me is, how do you create sanity inside a system that is designed for power and profit? Well, this is a political question. It's not a medical question. It's not a health question. And some people are making beautiful initiatives here and there, great community-based healthcare, patient-empowered healthcare, multidisciplinary healthcare. But as a system as a whole, the people that have and wield power and who garner the profits, and they're the ones who have the ears of not the ears, the pocketbooks, the politicians, the same thing. Politician hears through their pocketbooks. And
So I'll stop that there. There's a lot that he unpacks there, and he goes into a lot of kind of moral and philosophical questions around healthcare and the system itself. But I think something that really jumped out to me is how the person who was asking the question actually talked about the healthcare system as being a trauma organized system, and that actually potentially being one of the dominant paradigms that leads to some of this brokenness that we were talking about earlier today. And it made me really wonder and think about, what would it look like to practice health in the context of emotions, relationships, family systems, communities, environment, society. A lot of the practices that the indigenous cultures on the islands of Hawaii and others had been practicing for many, many years before sort of modern Western society came in and took over. Is there a way we can rebalance towards those things? Would that be useful? And I think one of the questions is really, it's not to paint a gloom and doom picture of healthcare and or to really point a finger of blame at folks who are practitioners in the field right now. I do think that most people in healthcare, whether they are at the highest CEO level or they're a physician seeing patients day to day, really do want to improve patient care. So I think a question is like, why aren't we better at this now? Why can't we do this better? What are the things we keep getting stuck on? And the truth is, it's hard. It's really hard to practice medicine in the context of emotions, family systems, communities, environment. And it's hard because we're human beings and we're limited in what we can do. And so here's where I think I wanted to ask a question around like, can AI help here, right? AI is good at large data sets, lots and lots of data. AI is becoming better at making cross systems connections, right? Pattern recognition in ways that we perhaps may not have been able to see. So like using AI as a collaborator to understand maybe recognizing a pattern for autoimmune diseases so that that person who wrote that article didn't feel like her diagnosis came so suddenly. There was actually a recognition of her condition much earlier in time. AI can save us time. It can move very quickly. And then I put privacy here in, but then with a question mark, because as we've seen with a lot of generative AI today, there's a really big question around privacy. But I know that especially in health, patient data and privacy of data is really important. So an example I wanted to offer in this space of like, how can AI help us do things that we weren't able to do before? Have folks raise your hand maybe in your physical screen, like if you've seen or heard of this example. This is an example from sort of a cross mashup collaboration between machine learning experts around the world and experts in ancient scrolls. So they're called, and I'm going to mispronounce it, papyrologists, something like that. But these are experts in universities across the world whose life's work is to decipher the language and the words and the content of these ancient scrolls that are made of papyrus. So last year, there was a challenge that was issued that was called the Vesuvius Challenge. The top prize was $700,000 that put out the challenge to machine learning experts and newbies around the world to see if they could create machine learning and AI algorithms to help read a specific test, this Herculaneum scroll that was covered in lava after the eruption of Mount Vesuvius, and nobody has been able to read this for centuries. This is from 8079. And there was I think a 20-year-old in Nebraska who was able to develop some kind of machine learning algorithm that was able to start to decipher words, right? So why do I share this example? It's just one example of how machine learning and AI can probably potentially help us see with new eyes or see with super eyes and with eyes that weren't able to see before, using the things that AI is very good at seeing. And I use seeing in quotes here just because I personally think it can be very challenging and potentially bad for society to anthropomorphize these AI technologies. And I see a lot of human language being used to describe the behaviors of what the AI is doing. And it doesn't quite get right what the AI is doing. And I think it can lead to a lot of misconceptions. So then is it all blue sky with AI? Will AI actually be able to help us combine our data on emotional health and mental health and society and environmental factors and help diagnose people with cancer, 10 years before would currently be able to do that. I want to play here. I want to actually go into an activity around some possible AI futures with you all. But before I do that, actually wanted to play a video of one perspective around different AI futures. And I will share with you all right now that this is a video. So this is a video of Sam Altman, the CEO of OpenAI, with Trevor Noah on a podcast called What Now with Trevor Noah. And I'm trying to get us around a paywall. So I'm going to see if this works. So you can let me know. I mean, I pay for the Spotify service, but I want to see if Zoom will let me share this. And I'll play about 3 or 4 minutes of this interview to hear sort of Sam Altman's perspective on AI futures.
Eliminating poverty is just inarguable.
So could you all hear that when it started?
A little bit.
A little bit. Okay, let's try.
A good thing to do. I think better redistribution of resources will lead to a better society for everyone. But I don't think giving away money is the key part of this. Like giving away tools and giving away governance, I think it is more important. Like people want to be architects of the future. I think as much as I could say there's been a consistent thread of meaning or of like a mission for humanity. I think it is like, you know, survive and thrive for sure on an individual basis, but collectively, we do have an emergent collective desire to make the future better.
Yes.
Now, we get off track lots of times, but the human story is like, let's make the future better. And that is technology, that is governance, that's the way we treat each other, that's like going to explore the stars, that's understanding the way the universe, it's whatever it is. And I have so much confidence that is so deep in us, no matter what tools we get, that base desire, that mission of humanity to thrive as a species and as individuals. That's not going to go anywhere. So I'm super optimistic about what the world looks like 2 generations from now. But what you got at is really important, which is people who are, you know, already in their careers and actually pretty happy and don't want change. And change is coming. One thing we've seen with previous technological revolutions is in about 2 generations, it seems like society and people can adapt to any amount of job turnover.
Right.
But not in 10 years, certainly not in 5 years.
Right.
And we're going to go face that, I think, to some degree. As we said earlier, I think it'll be slower than people think, but still faster than society has had to deal with in the past. And what that's going to mean and how we have to adapt through that, I'm definitely a little afraid of.
So I'll stop there, but I would encourage you all to check out the full interview. It's really quite provocative. And also recognize that Spotify does a good job of blocking the video from playing, but it sounded like you were able to hear the audio, but you weren't able to see the video. So sort of setting that up, there you heard Sam talk a bit about his tech optimism, but then also balancing it a little bit about the disruption that people across the globe might face as a result of generative AI. I wanted to offer a framework, and I really offer this as just like an activity that potentially you all could do in your different research groups or organizations, et cetera, in terms of like, how do you actually think about the future of AI in your field? And so these axes right now are defined as incremental to fast pace. You know, what are the futures if AI moves incrementally? What are the futures if AI moves in a fast paced way? And then what are the futures if AI moves in a sustainable manner? Like it allows us to sustain life more or less as we know it today, versus in a disruptive way. And I've started by putting in just thinking about AI, generative AI generally across the globe. You know, if we think about AI moving in incremental but sustainable ways, there's, you know, the bottom left-hand corner where maybe not much actually changes in the world as a result of generative AI. Maybe it's been a lot of hype. Maybe everything will remain more or less the same. And then moving over into an incremental, more disruptive space these ideas of personalized AI agents, and there's many other ideas of like AI solutions, AI technologies that are moving things forward, but they're moving things forward relatively incrementally, but towards the range of disruption. Then, of course, in the top right-hand corner, there's the idea of, just the existential threat of generative AI. And then the top left is, AI can actually help us do things that we previously weren't able to do for centuries. So these are axes that, may not be perfect, and I invite you to adapt them to axes that may make sense for you all in your work. But just in terms of just like doing a little bit of brainstorming to get a sense of what an activity like this might look like or feel like in you all's organizations, I'll ask folks to just take 3 minutes to think about, from the lens of healthcare or even just like your specialty, your area, what might go in some of these boxes, right? Like, what are the possible futures that you can see from where you're sitting right now? And then I'll ask folks to come off mute and maybe share 1 or 2 examples. So I'll pause there, and I will ask folks to take 3 minutes to give this question a little bit of a ponder.
My mind is blocked right now, and I think it's because I'm stuck on a few of the premises that you set up for getting to where you're at. And one of them was, why aren't we better now? And I'm curious, what time period were you thinking that things were better than they are now?
Yeah, I don't think I'd say that I think things were better than they are now. What I meant with that statement was, why aren't we better in this day and age at integrating some of the more holistic aspects of health into the day-to-day healthcare that patients receive?
So you're saying that why aren't we meeting our expectations?
Yeah, it's not
Okay.
a comparison to a previous time
So
period.
that's right. So that's different than the indigenous previous past and the experience indigenous people had with healthcare. And I'm also curious about, are you talking about evidence-based medicine or capitalist-based medicine as the problem?
Oh, that's I have not heard that distinction of terms.
Because they're very different. And if you mixed emotional trauma, bringing more emotion into practice with the cost and the dynamics of capitalism, and I think there's a distinction to be made there within evidence-based and capitalist-based, because they're not the same thing.
Yeah, I don't think that they are the same thing, but I do think that they are often intertwined. And to expand a little bit more on that, I think, at least from where I sit, which is not deep in healthcare, the things that get the funding to be able to show evidence are certain things, right? And the things that count as evidence, I think also is like what counts as evidence, what types of data, what types of studies, et cetera. I think there are tendrils of capitalism in there, but it's not a blanket statement that they are one and the same. Thank you. I appreciate the questions and dialogue.
Yeah, I mean, the other aspect is that a lot of this conversation is based on the fact that there's just tons of money available in the United States to even talk about this, and the vast majority of the world doesn't even have the luxury of this conversation. And the amount of money, for example, in a lot of the catchment area that we deal with in Hawaii, you know, there's no money for any healthcare. And so this expectation of things being better in the United States than it is now is one of really high privilege that is just very it kind of hits you in the face when you work in the rest of the world and you see that the expectations aren't there. And in trying to apply these 4 principles, for example, to the rest of the world, they're pretty much left out. You know,
Yeah.
we've been trying to apply AI to the Pacific, and many of the companies developing it have a lot of development costs to recover. And there is no way they're going to release anything or make it affordable so that any one of these 4 aspects can be applicable to the vast majority of the population until their money's made back. So I don't know. I just want to know your thoughts on that, because it's one thing to say that it shouldn't be a capitalist system. It should be something else. But in a lot of ways, we wouldn't even be having this conversation unless there was just an enormous amount of money. And also that when there's enormous amounts of money, it means that the data is held in silos.
Yeah.
And the data is not available for broad use so that the price can come down. So it's kind of a self-fulfilling situation where the money in the system allows us to talk about these things and to have this great conversation on meeting the expectations of us living in the wealthiest nation in the world. But we talk about removing the money because it doesn't have the emotional ties back to indigenous wisdom. So they're incompatible. You see what I mean?
I appreciate all of the deep thinking and provocations that you're raising, and I think they're really important. And I also I have thoughts that are my own, but I'd actually love to hear from some others on either what John has lifted up, and or some of the things that came up as you were working through some of these quadrants, because I think there's actually a lot of knowledge and expertise in the room beyond me. So I'd love to hear from other folks too.
Yeah, I mean, I think the data sharing example is a good one, and it's kind of specific to healthcare as well. In other communities, there's this big movement towards open source data sets, and that's allowed for progress in many fields and domains, and NLP and computer vision. In healthcare, not so much, and so that I guess there are these systematic barriers that lead to, I guess, more on the incremental and sustainable side of the axes. Another one that comes up though is, so when you talk to my class, we discussed a lot about AI alignment, and I think that, so when we have these large language models, that seems to be resulting in fast paced, and so that's going to be fast paced no matter what. But I'm thinking, and these are raw thoughts, maybe it's not correct, but that alignment might move more towards the sustainable side of the x-axis, whereas unaligned might be more disrupting, for better or worse.
Yeah.
Because you would, by definition, align to previous values, and that would push you towards the sustainable side of the axis.
Yep. Yeah, I'm gonna dive a little bit into that, into the concept of AI in a couple minutes. So I
Okay.
appreciate kind of lifting that up. I see Robert, if you go by Robert, has put in the chat ethics of data mining and data privacy, since AI is powered by enormous amounts of data. Did you want to speak to that, or just leave it as a chat? I will assume just leave it as a chat. Yeah, I mean, I think we're seeing a potential paradigm shift, and potential not a paradigm shift at all, when you have creators. The New York Times just sued OpenAI for use of its data, but what kind of power do patients, everyday people have in terms of their own data being mined to power these tools? Any other thoughts on potentially anything that John or Peter shared or that came up for you all when thinking about sort of future scenarioing around AI in healthcare?
So this is Bob Nishikawa. If you want actually things on this chart, I can give you some things from breast imaging that I understand well.
Yeah.
So, or not just breast imaging. I think the easy low-hanging fruit, which will be sustainable and I don't know, halfway up, but it's not incremental, but anything that has to do with segmenting. So radiologists, if they're, for example, trying to track how a cancer treatment is going, they have to segment something. If you have to do that from a 2D image, it's not unbearable, but if you have to do it in a 3D volume, it's like mind numbing. I don't think people actually do it. So we do things like longest distance because no one's going to segment those things. That's an easy thing for AI to do, I think. And it's definitely sustainable. Far end, top right-hand corner is obviously autonomous reading, which is nobody reads the image but a computer, and we're far from that. Probably in the middle, going down to incremental, will be things in breast imaging, like in Europe, all mammograms, screening mammograms are read by 2 radiologists. You can replace 1 radiologist with AI, and there's a lot of studies on that and shows that it works. Probably within a year or two, some country in Europe will do that because there's a shortage of radiologists. So the present system is not sustainable. So something has to be changed, and that's I think incremental. And I don't know, it's probably not disrupting, it's not this, well, I guess it's sort of sustainable. It's disrupting in the short term, but it's leading towards more automated reading.
Mm-hmm.
The last thing I just wanted to comment on, and I'm going off of this chart now, is your comment on the lawsuit against OpenAI by New York Times. So I don't have well, I have an opinion on that, but you can carry that over to, we have all these images of patients, which, I mean, when I use them, I don't have specific permission from each individual patient to use their image. And so there's a line from the New York Times OpenAI to healthcare. Yeah. And I don't know how to solve that or what the outcome should be for that. I think, I mean, there's precedent in healthcare, if you know about HeLa cells, which is a cell line that a lot of drugs, I'm guessing, or yeah, probably drugs were developed on, came from a single patient. Mm-hmm. And that patient sued and I believe won. I don't know the details of the case.
Well, a lot of that lawsuit is that they used her name and they identified her. And so okay. they didn't get her consent. They identified her, and the cell line is named after her. So that's a really complicated situation where she was wrong more, as well as they profited from her cell line. But yeah, I would say the most egregious part is that they named the cell line using her name, and she never knew it.
Yeah, I mean, I think all of these things are really like they're present moment questions, and I'm grateful for you all for surfacing them in this conversation, because I think that, and Bob, for you for sharing the things in the different boxes, as well as some of the thoughts around the lawsuit. I hope that it will be folks like you who are at the table when it comes to, what is the process for using medical images in training ML models or generative AI. What do we want that to look like for the short term, the long term, for the future of our patients? So I really offered this activity just to get that kind of a conversation going. And if it's useful, take it, use it in your organization, in your own personal work. I found it to be useful in mapping out my own brain in terms of the efforts that I was putting my energy towards when it came to generative AI. And then also being able to balance like risk versus reward in each of these boxes, and what were the things that seemed too risky to actually take on, and maybe were things to avoid right now. So that's the spirit in which that's offered. So I did want to do a very quick dive. I think we'll do a very quick dive into training LLMs, because we've sort of gotten into that naturally. Peter signaled it, and then also this conversation around data mining and the training of the models. So I'm going to make some assumptions that folks have some understanding of how models are trained, and if you don't, then we can dive into that a little bit more in the Q&A or afterwards. But there's two major ways that right now, at least, models are being trained. I'd say more the major way is reinforcement learning based on human feedback, the RLHF. And there's a different one that I've become aware of that's called constitutional AI, and that's really being put forward by a company called Anthropic. You see their product there in the middle, called Claude. And I won't spend too much time on reinforcement learning. That is kind of the basic model that a lot of the basic training approach that a lot of these models use. Essentially, it's just training a system based on reinforcement and feedback, and there's a human in the loop. And so you have here, you can see where that human in the loop is. And essentially, there's one human being, and sometimes you will be running the model through hundreds of raters, but essentially a given person in a given moment will tell the model, will prioritize and give the model feedback on which response, which output was better than the other. And then over time, the model will develop its own understanding of what humans want based on what all their raters say. Now, one of the things about this system is that it relies on an army, lots and lots of human raters around the world they're very well trained. However, they're just one human being, and they're making sometimes somewhat subjective decisions on like what is or isn't a good output. There's also there's also been research that's being done around having other models play the role of the human rater, so actually taking human beings out of the loop completely, and just having more superpower models train lower power models. So that is something that is on the cusp as well. One thing that I wanted to lift up, and this is, if anyone ever wants to sort of explain the different phases of training a model, I found this image to be pretty helpful, but I won't go into this right now. One of the other forms of training that I wanted to lift up was constitutional AI, and this is a screenshot from one of Anthropic's papers. You can see that they use a reinforcement learning model, but they also implement a constitution at multiple phases during the training itself. And the Constitution is actually a set of values and principles that, so the model is not making decisions solely based on what a human rater is saying is better, which output is better than the other. It is also running its outputs through this system of values, through this Constitution. Now, Anthropic developed their principles, their constitution, based on a very wide range of things, including the UN's Universal Declaration of Human Rights, as well as like indigenous values that they pulled, and they pulled from many, many different places. So I'm going to skip through this, but I wanted to just sort of show a little bit of the different types of outputs. And this is again from a research paper that Anthropic published. You can see at the top in the bold, the question, the input from the user. In the first example, you can see what the traditional lambda, so the reinforcement learning response was. The second one is actually a response of the Anthropic model. So lambda is the Google model. The Anthropic model is in the middle before it was trained on a constitution. And then the bottommost in the first example is after a constitution. In the second example, you can see the question that was asked. You can see before a constitution was introduced what the response was, and then after a constitution was introduced what the response was. So I won't spend a lot of time like reading through these, but I just invite you all to think about like, well, this was the difference that you see in output based on the values, based on the constitution, the principles that Anthropic decided to use. And for you all, for the work that you all do, I would ask maybe like, what would a healthcare constitution look like when you're training your models, right? If there's models that are being fine-tuned just for healthcare or just for a specific research study or project that you're running, in this question around getting alignment, would a constitution be helpful? And if it would be helpful, what would that look like? Who would get a say in designing the Constitution, right? Who would get to actually put together that list of values and principles? I will also lift up that at least as of October, Anthropic was experimenting with getting a public input on their model and their constitution, because they actually just sort of created that constitution on their own internally at the company, pulling from places across the internet, but they're actually seeking more public input now. So I'll actually stop there and see what you all thought of that last piece, and also just any questions or other provocations that came up for you across this talk, because I know we only have 5 minutes left.
Yeah, thanks so much, Dr. Shah. Let's give a round of applause. I could start with a quick reaction to your question about what would constitutional AI for healthcare look like. And I don't think it's I don't think it's specific to healthcare, but maybe any human-centered AI application. So there's a bunch of trade-offs that are kind of inherent, quantitative trade-offs in AI. So for example, there's an accuracy, privacy trade-off, right? The more data you provide, the more accurate the models can be, but then the less more information per person you provide, the less privacy there is for that person. There's an accuracy privacy trade-off. There's a fairness privacy trade-off. There's interpretability accuracy trade-off. And you could sort of move these dials and say, okay, I want a model to be on this here on the interpretability accuracy trade-off, and here on the fairness privacy trade-off, and then train a model with those, basically moving a dial. So I don't think that's necessarily specific to healthcare, but just some initial thoughts on what a constitution could look like for any human-centered AI application.
Thanks, Peter. Others?
I just want to say I really appreciated your talk today, and it brought up a lot of thoughts and controversy in my mind, but I'd rather have that than no controversy. So I don't know about this. Constitutional AI is something that could go either way. It could be useful in keeping us safe from situations that could get out of hand. It could also be patronizing of putting on values that one doesn't consider their own. So, but it's really rich area to explore.
Thank you, John. Others?
For as many people on here that I know are well versed in this area, I'm surprised they're so silent. But I think you've given us a lot to think about.
Thank you. I appreciate that. Well, thank you all for your time. I really appreciate it. And I will, Peter, oh, there we go. I can pass it back to Peter to close us out on this Friday on 2024.
Okay, well, yeah, I think this is a great way to start off the year. Thanks so much, Dr. Shah. And you're visiting Hawaii soon, right?
Yeah, February or March, I should be out there.
Yeah,
Okay.
please come by and visit.
Yeah, I'd love to.
We'll see you then. Well, take care. Happy Aloha Friday, everyone.
Thank you, everyone. Bye-bye.